It isn't 7 a.m. yet, and already the sun is high in the sky, gazing down at workers loading supplies into a waiting dhow. There is much ground to cover, and today the work will start at Mtangawanda, a village an hour away from Lamu, on a speedboat. A short brisk walk from the landing point brings the team to the local dispensary. Word that the health workers have arrived quickly goes round, and the usually deserted dispensary is quickly transformed. An abandoned table becomes a doctor's consultation corner, and a queue builds up on the other end. The ailments are minor for the most part. But the discomfort they bring must be eased and medication dispensed before the health workers move on to the next stop, many hours away on their dhow. A warm welcome awaits them in Kiangwe. Helping hands ease the loads of medication to be carried to a local primary school. Today it will serve as a hospital. Villagers who have waited a whole month for this day line up to explain what ails them. A burn here and a cut there. Even the smallest of injuries becomes painful when borne too long. On one side, women line up with their babies. Some of them tell us their children are yet to receive their immunization jabs. There are only 22 health facilities in the county, and none of them is located here.
Kama dokta leo hakuna, mtasubiri kesho takuja. Leo hii jioni atakuja. Na ikiwa hakuja kesho kutwa mbele mpaka haji.
This is the situation that awaits safari doctors when the team undertakes the journey once a month for 6 days, visiting 14 settlements across Lamu County. With a woman at the helm of the project that earned her a nomination as a CNN hero in 2016.
Ladies and gentlemen, it is my honor to present CNN hero Umra Omar.
Umra cuts an unassuming figure, mingling freely with the locals as the language rolls off her lips easily. She was born here 32 years ago, and a few years ago when she decided to settle here, the need for healthcare services prompted her to find a solution.
So while I was in Nairobi on vacation, we met up with an acquaintance/colleague who had brought up the project that they were running out here called Sailing Doctors. And unfortunately, due to the issues that had come up, that project had to close down as far as security and business was concerned.
At first, Umra thought she would keep the project alive for a few months, but she couldn't turn away from the hundreds in need of the services across the county.
I figured if we came up with an innovative model that, like the one that was there before, and found a way of making it constant, of moving around medical professionals, we could actually fill a good number of gaps that are there.
And so with donations from well-wishers and 2 seasoned nurses, safari doctors set sail. What began as a way to provide healthcare services to all would quickly turn into a boon in the area, boosting efforts to bring down maternal and infant mortality rates. The healthcare workers looking out for serious cases that need to be referred to bigger hospitals. The infant wiggles in his incubator, expressing his discomfort as the nurse fixes a tube up his nose at King Fahad Hospital on Lamu Island. His mother went into labor early. She arrived here on a speedboat ambulance.
Ambulance ikiitwa imekuja mpaka ndani ya Boni Forest kuchukua wagonjwa kuwapeleka Kiunga. We have a functioning ambulance upande ule.
It wasn't all smooth sailing.
Bahari ilikuwa kali kidogo kwa sababu kulingamana na maji kwetu ndo ana shida. Wanipaka maji yajaye ndo resi inapata kuja Lamu. Sasa ilichelewa kutoka kwa sababu ya maji.
Saa nyingine occasionally coxswain anakuambia ile sina mafuta ama sijui boti ni hivi, lakini most of the time wanaletwa direct.
In the next ward, another mother will go home without her child.
Hii mortality rate ya watoto ambao tuko nayo ni kubwa Lamu. Hiyo inachangia, hiyo pia ni sababu moja ya kuchangia. Maana wakija tayari wamekuja, kama ni mtoto kuanguka ashaanguka, kama ni bleeding mama amebleed mpaka mtoto amefariki, sasa inakuwa ni kuokoa yule mama tu.
Since maternity healthcare services in public hospitals were declared free of charge, the number of deliveries at the hospital has risen. Many, however, continue to grapple with complications at home. It is an issue that is close to Umra's heart. She too faced complications when she had her second child last December.
Both my births being borderline emergency, for me it's just a stamp that this is a personal venture of really trying to make an impact where I know how serious it is and it's very close to home.
Few residents have the luxury of travelling far for such services, and there are no private facilities here. Faced with this gap, the government beefing up Umra's efforts. An ambulance donated by the Beyond Zero campaign, one of those that ferry mothers to hospital, while the county makes long-term plans to increase access to healthcare.
Tumelilia hospitali, hakuna ambaye anatuuliza, tunalilia hospitali, jameni tusaidieni.
Days after our departure, we received the news that one of the twins in the incubators died, but the other was discharged and is thriving at home. It is a bittersweet victory, one that keeps the local heroes focused on their mission, month after month, until all mothers and their children are accounted for. Wilkister Nyabwa, Citizen TV in Lamu.